What is dysplasia in cervical intraepithelial neoplasia, CIN? Imagine your cervix as a protective gateway between your uterus and vagina, lined with healthy cells that grow in a controlled way. Sometimes, these cells start to grow abnormally, which is called dysplasia. In the context of cervical intraepithelial neoplasia, or CIN, dysplasia refers to these abnormal changes in the cells on the surface of the cervix. These changes are considered precancerous, meaning they have the potential to develop into cervical cancer if not caught and managed early. But it is important to remember that dysplasia itself is not cancer. It's a warning sign that abnormal cell growth is happening within the epithelial tissue, which is the outermost layer of the cervix. Most cases of CIN occur at a specific area called the squamocolumnar junction, where two types of cervical cells meet. This area is more vulnerable because of its unique cell composition. The main cause of dysplasia in CIN is persistent infection with high-risk types of human papillomavirus, or HPV. The most common high-risk HPV types linked to CIN are HPV-16 and HPV-18. While many HPV infections clear up on their own without causing any problems, some infections stick around. When HPV persists, it can trigger abnormal cell growth, leading to CIN. CIN is classified into 3 grades based on how much of the cervical surface is affected. The mildest form, called CIN-1, involves abnormal cells affecting about 1/3 of the surface layer. This often resolves on its own without treatment. Moderate dysplasia, or CIN-2, involves about 2/3 of the surface and carries a higher risk of progressing to cancer. The most severe form, CIN-3, affects the full thickness of the cervical epithelium but has not yet invaded deeper tissues. This stage is considered the highest grade of precancerous change and usually requires treatment to prevent progression. Most women with CIN do not experience symptoms, which is why routine screening tests like pap smears are so important. These tests can detect abnormal cells early, often before any symptoms appear. If abnormal cells are found, a procedure called colposcopy allows doctors to examine the cervix more closely and decide if treatment is necessary. Without treatment, especially in higher grades, CIN can develop into invasive cervical cancer over several years. That's why early detection and management are vital. Treatment options depend on the severity of the dysplasia. For mild cases, doctors may recommend careful monitoring with regular pap tests. For more advanced cases, procedures like removing or destroying abnormal tissue can be performed to prevent cancer development. Vaccination against HPV is also a powerful preventive tool, as it protects against the most common high-risk types that cause CIN. In summary, dysplasia in cervical intraepithelial neoplasia is an abnormal growth of cervical cells caused mainly by persistent high-risk HPV infection. It is classified by severity, with higher grades needing more careful management. Early detection through screening and vaccination are key strategies in preventing progression to cervical cancer. Always consult healthcare professionals for personalized advice and follow recommended screening guidelines to stay proactive about cervical health.